Okay, welcome everybody. We are starting with the session, Get Moving, Reclaiming What Systemic Sclerosis Took Away. And I'm very happy to welcome you here and welcome our first speaker, Professor Janet Poole. She's an occupational therapist and has been working with people with systemic sclerosis for over 30 years. She has developed hand and face exercise programs and a self-management program, a fatigue and activity management program, systemic sclerosis, and making it work, systemic sclerosis, all of which were developed in collaboration with people with systemic sclerosis. Dr. Poole has been a co-author on articles on the non-pharmacological management of systemic sclerosis.
Thank you, Linda. Hello, everybody. Get to my slides here. I feel like since it's like right after lunch, instead of having you sit there, we probably should be having you move and walk around, right? But I don't think that's what's going to happen. You can, though. You can walk around if you need to move around to keep awake. So I'm going to talk about management of systemic sclerosis through physical activity and exercise as kind of an introduction to what the next two speakers will be talking about. So my objectives are to describe the types of physical activity and exercise and talk about barriers and benefits of physical activity and exercise, and then to kind of explore how to incorporate physical activity into your daily routines through setting goals. So if you think of physical activity as all planned and unplanned movements throughout the day, you can think about it as practically everything that you do. You know, you walked in here, you got up in the morning, you went in the bathroom, the shower. All those are kind of the unplanned activities that you do. I think a lot of the ones I have on the table here are more of the planned things. But, you know, you don't really plan to make the bed. You just kind of have to make the bed. Rake leaves, some of these things are things that you just do because they're part of your home maintenance or gardening or just the things that you have to do. But there are also things like taking a walk, taking a hike, jogging, cycling, indoor cycling, doing different sports, yoga, walking to the train station, maybe walking to your car from work or a parking lot at a grocery store. All those types of things are also planned activity that we do, but sometimes we don't. Some of them we think about it as exercise, but they really are also just physical activity. So if you think about exercise is planned, repetitive engagement with the goal to improve health. And there's three main types of exercise, and those are aerobic exercises, which are the ones that we do where we increase our heart rate, and they increase cardiopulmonary fitness, and they increase muscle function. Then there's also resistive exercises that you all have heard of, you probably all do. Lifting a weight, there's some type of resistance. It could be like water could be resistance if you're swimming. It could be the weight of your limb. And resistant exercises increase muscle function, and they also increase bone health. And a lot of times people are, not just because of age, but also some of the medications that people are on may make them more prone to osteoporosis. So doing these resistive exercises and weight bearing can be particularly important. And then stretching exercises, like often you may do for like particular joints, if you have your hands are involved, like hand exercises, they increase muscle and joint health. But when you have a chronic condition, such as systemic sclerosis, there can be challenges to doing some of these physical activities. Some of you may have pain, you're uncomfortable. It may cause you fear to do an exercise program because you're afraid it might hurt more. Fatigue. If you were in the last talk, a lot of people are fatigued. It's one of the number one symptoms. If you're fatigued, you may not really want to exercise because you're afraid you're going to be more fatigued. Fear of overdoing. Decreased strength, depression, may not be really motivated or want to really move. Limited motion in joints can make it hard to do different activities. If your hands are involved, it can be hard to really hold on to maybe weights or handlebars or whatever it is that you're doing. Being breathless, again, that can make people not really want to exercise. GI and bowel problems. So if you were in the last two talks, both the GI one and the fatigue one of the common things they said was, for both of them, that exercise is medicine to help combat and work with some of the GI problems, but also the fatigue. And then if you have Raynaud's or the hand issues or ulcers, then having to think about temperature can make it difficult. However, there is research that supports that having supports can help people do physical activity or be kind of motivated, get involved with it, enjoy doing it. So one is confidence in what you can do. I'm talk about goal setting here in a little bit, and one of the things we'll talk about is your confidence. How confident are you that you can reach a goal? Knowing what to do. A lot of times people say, well, I'm told that I need to be more physically active, but oftentimes nobody tells you exactly what you should do to be physically active or what activities might be good. I'm setting achievable goals. Start easy and progress slowly. My slides got messed up here. Start slowly, like especially if you're just starting. And then planning for weather or environment changes. Because you may have a really great plan and it may decide to snow tomorrow. Hopefully not here. But doing exercises or physical activity with others, having an exercise buddy is really a good support, because then you are that person you think it's depending on you to show up. So that's a little more motivating to show up. And you are also counting on them to show up. And then using trackers or mobile apps can be supports too. There are overall benefits of physical activity, and these are not just, a lot of these are not just for people with systemic sclerosis, but for everybody. Exercise, physical activity build and maintain muscle strength and tone. They support joints and stabilize because of that muscle tone. Exercise does decrease fatigue. It increases mobility. General mobility, not just joint mobility, but just being able to move and walk, get up and off of a chair. It helps people sleep better, and it decreases stress and anxiety. And as I said earlier, helps the GI tract work better. Increases aerobic capacity, exercise tolerance, increases the quality of life and well-being, improves circulation in the hands and the feet and the core, improves breathing, does everything, right? So suggested to improve social participation and body satisfaction and decrease pain. So exercise is a type of medicine. So be active. What should you do? What do you want to do? The main thing is, what do you like to do? Because if you're doing an exercise program or a physical activity and it's not something that you are interested in doing, what's your motivation going to be like? May not be very motivated, right? If it's something you don't really want to do. It could be, doing yoga, walking, dancing, running, swimming, cycling, but almost all activities, whatever it is that you like to do, we can increase it in intensity or duration to help with overall fitness and health. So can I ask you to raise your hands if you are involved in physical activity? All right, that's great. That's wonderful. It's terrific. So one thing, and unfortunately we can't really have a conversation here about what kind of keeps you motivated to do that. A lot of times it's overall health. That's the basic general goal that people want to reach. So when you think about starting or maintaining some physical activity program, I like to suggest, and I think others do, is sort of a self-management approach to set goals and then develop a plan of action. So you ask, what is it you like to do for physical activity? What can you do? And that can help guide goal development. And that also helps with motivation, because if it's something you want to do, then it's important. Then you develop an action plan about what is it you're going to do. And I'll talk about this in a few minutes. And then assess the importance of it. How important is it to you to do this activity to reach this goal on a scale from 1 to 10? 1 being not important to 10 being extremely important. If you say less than 7, then it's probably not that important, and you may not really work that hard, or that may not be important to you, so you don't really do it. Then you assess the person's confidence. How confident are you that you can do this goal or reach this goal? Again, from 1 to 10. If people say less than like a 6 or a 4, they're not really confident, which probably means the goal might be set too high. And then follow up and feedback. In our groups, we have people actually do feedback on what their goals were the next week. And so one person said to me, if I told you I would do this, then I have to do it without lying about it, because the next week we would be asking, what did you do? Did you achieve your goal? So how to get started, to set a goal. So one thing is to self-monitor to measure progress. You can look at heart rate, you can look at oximetry. A lot of us have phones, you have your Fitbits, you have your cell phones and your Apple Watches, all those gadgets. You can have a pedometer, and all those can help you keep track of what you're doing. You can use landmarks, too, for distance, like you're going to walk to the next house or the next mailbox. Think about logistics. It is normal when people are active and get more active for heart rate to increase. Breathing gets heavier when you do physical activity, and you tend to perspire more. And you might be a little bit sore or a little bit in pain if you have suddenly started something up that you haven't done. It's also good to have a backup or contingency plan, because you have a really great idea what goal you're going to reach, but then the weather could change. We in the United States just went to daylight savings time, which is really great because you have an extra hour at the end of the day of daylight. But when you switch the other way and it gets dark earlier, then you sometimes have to restructure your programs. The environment is important too. If you have smog or fog or even safety concerns. Symptom flares, if you have flares, you may back off a little bit. Illness. So sometimes you have had incidents where you can't really do any physical activity. You really are too sick, or you've been in the hospitalized, and then trying to start back again and thinking about how can you do that on a graded way instead of starting right off the bat. We had a gentleman in our group that was hospitalized, and he came back. He said, well, I'm going to go back to exercising 4 days a week for 30 minutes. When I said, how confident are you on that? He goes, I'm going to say 7, because if I say a 6, then you'll make me change it, which I did. Because I said, that's probably too much if you've been out not doing anything for about a week. Maybe back it off to 3 times a week for 20 minutes or 10 minutes or 2 times a week. And then a lot of people say, they don't have time for physical activity. So just like fatigue or anything else, we have to schedule breaks. Schedule when you're going to do this. So develop the action plan. What is it you're going to do? How often? How much? When will you do it? When will you start it? And where will you do it? And then looking at confidence. So these are some examples here. This week I will walk for 10 minutes on 2 days. So the person's confidence level was 4, which meant that might be too much. If they aren't confident, they're going to do that. So maybe we revise the goal to walk for 5 minutes on 2 days or 10 minutes on 1 day. And then I would probably ask, what day are you going to do this? What day of the week? Another person's goal is this week I'll walk on my treadmill for 30 minutes, 5 days a week. That person's confidence level was 8, so they probably would reach that goal. And then another person was, this week I will meet W on Zoom at 10 a.m. and do virtual boxing for 30 minutes 2 times. And they chose Monday and Wednesdays. And the confidence level was 6 to 7. So then thinking about that's kind of borderline, would it be maybe back off? Is the time, is 2 times a week too much? Is the overall time too much? So setting those goals helps you get a goal, you work it into your schedule and your program. It's, as you know, physical activity is very different from Taking medications. Medications, you have all your medications, you take them at certain times a day, but starting physical activity programs or continuing, that's a behavior change, and behavior change takes longer to work those into your routine so that they can become a habit. So I'll end by saying take-home messages, physical activity improves symptoms, health and well-being, continuing or beginning to be active and moving. And use action planning to set your goals to increase physical activity. Check your progress and goal achievement and modify them. If you don't reach that goal, it's okay. Think about why. Was it too high or was it just kind of an off week? Choose to do the physical activities that you enjoy, and they can be disease-modifying medicine for people with systemic sclerosis.
Thank you very much, Janet. Do we have a question here, or can we go on to the next speaker? No? Okay, that's great. I only have one question. You were talking about all sort of technical digits to help to get moving, and I think it's very challenging to have the discipline to go on walking. Is there a sort of program you have in your country you can promote?
There's often, unless you have a Scleroderma group that does it, oftentimes there are not. But again, if you think about making a schedule and you have agenda or something probably any day, or you put it in your phone as a reminder, and that's just something that you do at 4 o'clock. If you're done with work, or you're going to get up in the morning and you're going to do a particular routine, you put it in reminders so it shows up and reminds you to do that. I think that's really the best way, unless you, or you could go to have a class, you could go to an exercise class, in which case, you may have to go somewhere. Sometimes it's easier to start when you don't have to go anywhere except for your own home or walk around, the block or something like that.
Thank you. Thank you. Well, we go to our next speaker. And it's Rubén Duarte Fernandes, if I say it correctly. He's a specialist nurse, research assistant at the University of Leeds. He has a decade of experience in Coimbra rheumatology department with a master in public health. He specialized in managing rheumatic diseases, emphasizing prevention, education, rehabilitation, and physical exercise. His experience extends to sports rehabilitation, enhancing patient care. Presently in Leeds, he pursues his PhD in systemic sclerosis, wound care, showcasing a commitment to advancing healthcare knowledge and improving patient outcomes. Please.
Well, hello, good afternoon, and thank you all for being here. Thank you to the organization for inviting me to be here in beautiful Prague and be able to talk to patients and overall people and get moving. That's our own goal. So as Linda perfectly said, I'm a rehab specialist nurse, and currently I'm working at the Leeds Institute of Rheumatic and Musculoskeletal Medicine in the UK. And I'm here today to talk to you about a project that we have, the iFitness project, which is an internet interdisciplinary education for systemic sclerosis. It's a project granted by EULAR, and it has the coordinator, Dr. Ricardo Ferreira, and several other experts that we also have in this room. And we're trying to develop this kind of telehealth project for everybody with systemic sclerosis, so you can use it at your own suitability. So our aim is to, this way, jointly develop a web-based program, an e-health program, on patient education, on lifestyle behavior, with focus on promoting physical activity. So of overall exercise for patients with systemic sclerosis. And we want to test its usability and feasibility in 4 European countries: in Portugal, in Austria, the Netherlands, and in Sweden. To manage this, we try to make it in a 3 phases strategy development. And the first one we completed with a scoping review, which is a literature review. And the second phase, we will still developing the program and video record. Now, at this phase, we are in post-production mode. And we also have to evaluate all the modules and then validate it with the team so we can publish and be certain that all the information you gather is correct and assertive. And the next step will be the usability and feasibility evaluation, which requires a website testing. And we try to aim for 10 patients per country, if we can do it, to test it and be able to say, yes, it's perfect or almost perfect or ready to be delivered for everybody. So the scoping review, what we do find out quickly, that we also know that people with systemic sclerosis and other connective tissue diseases experience limitations in physical activity and mental function, activities of daily living, and participation in daily activities, so also leading to reduced quality of life. And the most common interventions, we know that the patient education, the self-management, and the physical activity and exercise and advice regarding healthy lifestyle are very important. So how might we translate this to our program? We'll try to use multi-component interventions and publish it in telehealth format and target different needs in patients with the connective tissue diseases. And this will allow patients to an easier access to specialized health professionals, which most of the time the question is, how can we be certain, or can we address, or can we get some information? And regarding the program development and video record, we'll have an introduction by Dr. Ricardo Ferreira, which will explain the project overall aim and how to attend the online program, like the index and how to navigate on the site. And then we'll have some general health advices by Dr. Tânia Santiago, presenting a brief overlook on systemic sclerosis, the need and importance of education, and non-pharmacological interventions. And then we'll follow along with designing the individual plan. And myself, I'll be explaining the importance of exercise, which kind of exercise are recommended, and which rules or plans to follow throughout the program, including breathing control techniques, relaxation demonstrations, which are very important to perform during recovery times. So the overall goal is to demonstrate the exercises. They will be performed by actual patients, simulating the common environment that you have in your own places, displaying key messages and with subtitles according to the selected language. The 3 main exercise areas will be the stretching and mobility, which we call the range of motion, then the strength and resistance exercises, and finally, the aerobic exercises. For the first one, the stretching and mobility, we will also begin every time, every module, or every part of the module will also start with the general information, and then we'll head to head and neck exercises, face and mouth, upper limbs, back, lower limbs, and then foot and ankle. Most of the times we have the exercise performed by both of the patients, and we have like a normal level and like an easier level, so patients can do it and you all can do it easily and follow the program. For the strength and resistance, also, like I said, we start with the general information on the module, and then we head to head and neck exercises, chest, shoulder, and arms, upper limbs, back, hips, and knees. As you can see in these different pictures here, we have both of the patients performing the same exercise, but here with some resistance, and here without the resistance of a weight, but only with using the weight of the arms, of the own arms. And here, performing some chest and exercises, also in the same way, and some back exercises. For the aerobic, we tried to do according to what is being told to us and asked to us. We tried to also start with the general information and then kind of do a boot camp where we use some patients to demonstrate the walking, jogging, static bicycle using for the arms and the legs, and Nordic walk with the sticks to help and aid the walking. And then some special and different activities like the yoga. We had a professor in yoga, which is also a health professional, that demonstrated how you can do it easily and safely, some yoga exercises. And then we had a professor in dance that showed us some steps, some moves that we can do and also have some fun and regain the mobility and the exercising in a different way. As an extras, we added some patients' testimonials that will tell us the difficulty of the exercises, how fun or difficult, or how they recommend it also for everybody to do it. And we hope that you also will like it. As take-home messages, I have to say that our project has a very specific scope of area of intervention. So it's based on this scoping review that we did, and the exercise performed by real patients in these three main areas: the stretching and mobility, the strength and resistance, and the aerobic. And the process update now is under team validation and ULAR post-production, and we hopefully have it ready as soon as possible. We also have to highlight that you always need to seek help from a health professional before starting a plan. That's mandatory, so you can have the information, because we don't have all the information regarding systemic sclerosis management displayed or discussed in this model. It's more about the exercises. So always seek help from someone that can guide you through all the process. And the overall systemic sclerosis management information is available in a modular online program format, which we recommend visiting the website Management Scleroderma to complete all the information. As disclosures from the people who I work for and with. And I would like to let you know that if anyone is interested in being part and helping translating into a different language that is not in the program so far, you're able to do it. So just contact us, and we certainly include you in our project, in our work, and we can translate it into another language if possible, as soon as possible. So thank you very much for your time. I'll be open to any questions. Thank you.
Thank you. Thank you, Duarte. That was very interesting. Is there any questions for Duarte? No? Sorry?
I have a question.
Okay.
When is going to be available, this project online? Do you have any date?
Actually, we already overdue the date that we were proposing, but what I can do is we're trying our best efforts to deliver it as soon as possible, because it's a long process. We want to be assured that all the information is correct and safe to be performed by all patients. So we also have to include every health professional from the team and other stakeholders like yourselves and other patients around Europe and in our countries to test the usability and feasibility of the exercises. So we want to do it as quick as possible, but we want to do it like properly also. So.
Okay, thank you. I have only also one question. The people who were involved in the project, were they in a mild condition, severe, or what was the criterion?
Well, all the patients were disease controlled, our rheumatologist clinicians, but yes, we have one of the patients which has a more severe disease, and the other one at the time was more in the initial phase of the disease. Not
okay. Thank you.
So that's why we wanted to do it like properly with a difficult one, like more difficult for the other patient, so she can show us, okay, I have these kind of difficulties. I have to move this kind of, change this kind of exercise, so we have to adapt it. And sometimes we show that, okay, if we can't do it like this way, let's try to adapt into another form. So we try to do it as most real as possible to help all our patients.
Yes, okay, thank you. If there are, there's one more question.
So then,
There's one more question.
Hello. My question really is directing to Janet. You showed a brilliant slide, and motivation, depression was one of the main factors in any chronic illness, especially scleroderma. That is a sort of a obstructing factor that makes you stop exercising anyway. So have you got any tip with these patients that, because when they get there, sort of when they start, and then the sustainability is the next step. But how do you counsel them to get there? I know that nothing fits all, and each person is different, but in your experience, what tip you give that works better?
Well, that's a really good question, and I think a lot of times it will depend on the person too. If there's somebody else they can exercise with or do something with, even taking a walk with a friend, family member. People mention, walking a dog or animal like an animal. Sometimes that can help get people motivated to do that. Sometimes too, just think about what is their overall goal that they want to be able to do, and talking about how being more physically active can help reach that goal. I've run groups, and sometimes the power of the group is really helpful too, in saying, because they give their ideas of what they do, and then somebody might say, oh, I think I could do that, and then working with them to sort of develop an achievable goal that's not too high or too low, but then also checking in with the person. I think that's kind of what a program like yours would do too, is to do. I think it's sometimes that accountability where people come back and say, well, I really didn't do that well, but it's like, but you did. You didn't do it maybe as long, but you still did it. And sometimes that helps.
Okay, thank you. Thank you for your question. Do we have any questions? Then we go to the next speaker, and I welcome Tânia Santiago. She's going to talk about skin hardness in systemic sclerosis, how we can improve it. Sorry. She's a professor specialist and she coordinates Scleroderma clinic and capillaroscopy of rheumatology department in Central Hospital in Portugal. She's interested in outcome measures in systemic sclerosis with a PhD on applications of ultrasound assessment of skin in systemic sclerosis. Please start with you.
Many thanks for the introduction. Good morning to all, or good afternoon. It's a great pleasure for me to be here, to have this honor to make this presentation and this talk. So the topic of my presentation is skin rehabilitation. And here are the topics that I'm going to address during my presentation. The importance of skin rehabilitation interventions. Then some slides about studies on rehabilitation intervention, which actually evaluate skin as an outcome measure, and then ultrasound as an outcome for skin assessment in future clinical trials. So now I would like just one slide explaining why is skin rehabilitation so important. I think you all know that it's very important in mainly 4 dimensions of the disease. So skin rehabilitation is crucial for mainly 4 reasons. First, because it prevents and reduces disability in the hands. Also, it improves movement, as we have seen, function, strength, and activities of daily life. Also, concerning the face, it prevents and reduces disability in the face because it improves mouth opening, disability, it improves mime facial expression movements, and alignment of the cervical spine. Also, it improves quality of life. It improves self-esteem, global subjective well-being, and work and leisure activities. And finally, skin assessment is important for patient perception of the impact of the disease. And let me just give you 2 slides about the importance of the patient perception of the disease impact. To a deeper understanding of the importance of the skin and body image in systemic sclerosis, we have conducted a multi-center cross-sectional study in Portugal with 6 rheumatology Portuguese centers. We included 142 patients with systemic sclerosis, and we collect data, demographic and clinical data, but also questionnaires about disease activity, disease impact, health-related quality of life, personality, and happiness. And let me show you how this model looks like. This is our proposed model, but don't be scared because I will explain you the main associations that we have found. So please look at the impact of the disease here. We have found that the impact of the disease is mainly related with the body image satisfaction, but also with fatigue, and also with social support, and to a lower extent with disease activity score and disease form. Also, we found for the first time that the impact of the disease perceived by the patient affects negatively the quality of life and happiness. Also, we have verified, and this is very interesting and curious, that a positive personality are very important to happiness and for the global subjective well-being and the impact of the disease. Meaning that if you have a more positive personality, it may have a positive impact on reducing the impact of the disease. So it's very important that these treatment strategies, of course, it's very important, focus on the biological treatment and organ involvement, but also in the domains of the disease, such as body image, fatigue, and social support. Now, moving on to the evidence to support the value of the rehabilitation interventions. So this work was published in 2022. This was a systematic review of the literature about the rehabilitation interventions in systemic sclerosis of the last 20 years. And this review have included higher quality studies that are used to inform the effectiveness of these interventions. But just before going to results, I would like to just clarify that we, in our clinical practice and trials, we use the modified random skin score. It's the current gold standard that physicians use for skin thickness assessment. It is assessed by palpation of 17 body sites and scores thickness, 0 from normal and 3 severe thickness. It's very useful score in clinical practice. It's quick and easy to perform, but it have some limitations. So one solution that is being explored is the possibility to perform the Rodnam score using ultrasound. As you may know, ultrasound is a more objective tool. It provides quantification data, is more reliable, non-invasive, and is widely available in our rheumatology departments. So, backing to the review. The review included 16 studies. And what were the results? In half of the studies was demonstrated a benefit in hand and upper extreme function and healthy related quality of life. But crucially, only 2 studies out of the 16 included skin as a measure of effectiveness. Now I will show you these 2 studies in the next slide. So the first study tests the impact of a 9 weeks treatment within paraffin walks and hand stretch exercise 10 times a day versus hand stretch exercise only. Unfortunately, this intervention had no impact on the modified Rodnan skin score evaluated at the hand. In the second study, that included 200 participants with a longer follow-up of 1 year, a personalized supervisor physical therapy program was provided by trained care providers and followed by home sessions versus usually care. Unfortunately, this study also had no impact on the Rodnan skin score. More recently, however, in a third study, we have for the first time that ultrasound can be used to evaluate the efficacy of rehabilitative interventions. In this case, was made an intervention based on lymph-touch machine that was used. So the authors, they have concluded that this may be a measure very useful to use in addition in other outcome measures that can be used in future clinical trials. And we are also here in my department in Coimbra using this ultrasound to evaluate skin. As you can see here in these slides, it's me performing ultrasound, and with ultrasound we can see the skin layers. With the beam mode software, we can see the skin layers perfectly with different interfaces. We see the dermis, we see the epidermis, hypodermis, and fascia, and we can measure all these skin layers. Also, we are using the software of elastography to measure the thickness of the skin. So, just for take-home message, skin rehabilitation have a multidimensional impact on people's life, as we have seen in the first slides. Evidence found benefit in hand and upper extremity function and healthy related quality of life, but few studies on rehabilitation interventions have evaluated the skin. So maybe considering other outcome measures such as the skin ultrasound and the elastography, it's very useful for future studies. So thank you very much for your attention.
Thank you. Thank you very much. Are there any questions? There is at the back.
So can I ask then, what is the skin rehabilitation? The paraffin 5 times a week didn't help because the results were not statistically significant. The physio and the rest was not statistically significant either. So what is classified as skin rehabilitation in your mind?
I just would like to highlight that maybe those studies, they use the modified Rodnan skin score as an outcome, but those studies, they have other outcomes, and some of them were achieved, were reached, but not in skin. In skin, they have no impact. So what I am making raising these hypotheses is just maybe we are not using the proper outcome measure to evaluate the skin. Maybe if we use ultrasound, that's non-invasive, it's non-radiation. Maybe we can have other results.
Yes, but
I didn't understand properly, sorry.
Can you tell me what skin rehabilitation is?
Skin rehabilitation, I think it's just like a small part of the rehabilitation. So, of course, I think the main focus must be on strength, on mobilization, on improving the range of movements. But, of course, if we have improvement in skin, it would be fantastic. But I don't have a proper answer for you in saying what is specific skin rehabilitation, because I don't think we have enough information from the studies. I don't know if you want to comment.
I can try to add some more information. Yes, when we try to do rehabilitation, we don't do it just for the skin, we do it for all the tissues. So we're trying to work on the muscle, on the fascia, which is very important also because it surrounds everything, and the joint, and also bone, including. The skin is part of it. So as Tânia said, we don't have enough information about the skin changes, but we know that for joint mobility and for strengthening the muscles, the rehabilitation itself helps, of course, it helps. But for the skin itself, we cannot say like tangible measures, okay, we achieved this with this kind of rehabilitation. But yes, part of rehabilitation is the paraffin wax, careful with the warming of the paraffin, is what I always say, the massage, the stretching, the mobility. So you're trying to do and address all tissues in the human body. So it's not only for the skin itself, but we have lots of things that we can do, like mobilizations. Also, the scrapping is very typical, but we have to check which kind of patients could we do that kind of therapy. It's very, very subjective. So always seek help for a proper health professional before starting doing any kind of plan. That's my major advice.
I guess the only thing I would add is what you were talking about, the lymphatouch. It's really one of the few things that really does work specifically on trying to loosen up the skin and the connective tissue. The paraffin helps to increase the temperature of the connective tissue, extensibility of it, but really the lymphatouch is really the only thing that so far has really focused on loosening up the skin, but it has to be applied by somebody who knows what they're doing, at least in our country, and I'm assuming where you are too. So I think that what you're saying is that using the skin scores to look at the skin may not be the best way to evaluate that, because, you know, is it function, but it's the skin that is the tightness that helps to lead to all the contractures and everything else.
If there are any questions left, then I want to thank you all for coming and have a good flight if you are going back today. I want to thank Janet Poole. I want to thank, I said your name wrong, I think, or not. Rubén, Duarte, Fernandes. And I want to thank Tânia, Santiago. Thank you for coming and for the information. Thank you.